Hello and welcome to this video on the degrees of burn. The first type of burn is public shame at being rebuked or countered with a bitter and harsh reply. This is perhaps the most common kind of burn, but certainly not as clinically relevant, unless your workplace practices a strong culture of banter, in which case, yes, being burnt socially may actually be a regular thing. The more clinically relevant type of burns relate to things like friction, cold, heat, or thermal as it's generally described, radiation, chemical, and electrical. In short, most of these are going to apply to a certain extent. However, we'll go through them effectively in a process of frequency. So first of all, we do have friction burns. These are essentially when you have your body rubbing against something hard and literally tearing off bits of your skin, but what doesn't get torn off gets heated, and that heating causes a burn. The most common kind of cause will be something like, say, a motorbike accident. A carpet burn is another example, although that one's typically not something pointed out initially when clinically presenting. It's often followed up once you're in the emergency room. They're asking, now tell us the real story as to how they got stuck in there. Friction burns are therefore among the both widest ranging and most common, but the reason they range so widely is that it varies from your butt getting burnt on the carpet during physical exercise, through to falling off a motorbike and going hundreds of meters down the road and creating road jam. The cold burns are, well, let's be blunt about it. They're less common, but depending on where you are in the world, and certainly the time of year, they can be far more frequent. This is, for all intents and purposes, a frostbite. The reason it works is, well, the cells in your skin get cooled to such an extent that the cells themselves get destroyed, mostly through the formation of ice crystals, or through the lack of provision of oxygen through blood vessels, mostly arteries, constricting to try and keep your blood as close to the core of your body and keep the core of your body warm. Now, the frequency, as mentioned, will vary notably throughout the year, and for the most part, unless you're in the extreme latitudes of north and south, are really only relevant during winter. You will also occasionally encounter it when some idiot decides to find themselves a metal pole and lick it. It is a bad idea to lick a frozen lamppost. Your tongue will get stuck to it and get damaged, leading to burns. The thermal, or effectively high heat burns, are what we would be most familiar with. It's the kind of burn that most people would expect when you say burn. It's, well, from simply touching something very hot, or in some instances being exposed to an environment that is very hot. So for example, if you're in the desert, the heat itself can burn your body. The damaging process doesn't need to get to temperatures you might think of as burning typically. But then again, touching something hot can cause it as well, or being exposed to something like, say, steam. Steam being a particularly nasty way of doing so. But no matter what the exact mechanism for thermal burns is, the results are very much similar to, say, cold burns. The cells get damaged and eventually die, and now you have damage, and therefore burns. Radiation's a bit more unique, and arguably, most people are going to be less familiar with it and certainly not think of it, unless we're talking about places like, say, Chernobyl in Ukraine, or Hiroshima and Nagasaki in Japan. The radiation that occurs can lead to the DNA being damaged. Damaged DNA leads to the cell eventually being destroyed, and this causes burns, and possibly cancer if the cells survive, but this is very much a dose response. That is, more radiation, more likely are to get burnt rather than cancer. Chemical burns are, again, less notable because they less often present, but occasionally they will. Things like, say, acids, some solvents, and certain detergents can cause it, and at least initially a lot of people will attribute it to just being an allergic reaction. And to an extent, that is what an allergic reaction is. It's a chemical burn, at least in the case of, say, things like detergent, solvents, and similar. Electrical burns are the last candidate, and for most individuals, unless you're into, say, DIY, changing electricals in your house, or working as an electrician, this isn't as common. And, well, it's exactly what the name says. An electrical current tries to pass through your body. Since your body acts as a resistor and therefore holds on to the energy, it has to dissipate it somehow, and the way it dissipates it is as heat. That heat damages the cells and you now have a burn. The type of burn can be less important in most cases rather than the degree of burn. Not because the type of burn is irrelevant, but because the degree of burn directly relates to the severity of injury, the immediacy of need for treatment, and how likely you are to recover, and how much you will recover if you will at all. The first degree burns are what most people are familiar with. This is what everybody's encountered at some point in their life. Whether it is, for example, sunburn, slightly hot, say a mug or teacup that you scorched yourself on, things like that. It only affects the very outer layer of your skin. This is the epidermis. You will basically have very mild effects from it. You will have a red and painful swelling, but that's it. There's really no long-term harm, and this is why it is generally considered the mildest form of burn injury. Because it only affects the very outermost layer of skin, the epidermis, it really doesn't do much. To be clear, it can, particularly if it occurs regularly, it will increase your risk of skin cancer, but the actual impact outside of that is fairly limited and will more or less go away of its own accord. The general symptoms will always be redness, where the skin is obviously being harmed, some swelling, at least some pain, but most of this pain is going to come from being touched rather than the actual swelling itself, dry skin, and eventually peeling as the skin heals. Treatment is equally simple, and that is, you generally want to run cool water over it. So basically think of, you've touched something hot, what are the immediate first aid solutions? Applying moisture to this, particularly only for these first degree burns, covering it if it's a little more advanced, or if you have concerns about, say, broken skin or similar where infection could occur as a result. For example, if you, say, have a cut and then you've burnt that same area. And of course, given the most common cause is going to be things like exposure to sunlight and therefore sunburn, you want to avoid exposing that part of your skin to further sunlight. Typically speaking, it'll heal within a few days to a week, and it's fairly benign. Uncomfortable, yes, but benign. The second degree is where things get a little more serious, let's say. In fact, arguably a lot more serious. This is where the outermost layer, that epidermis, has been damaged, but also, to a certain extent, the dermis underneath that, and that's a problem. The obvious indicators at first are going to be things like a bright red, swollen, and suddenly shiny or wet-looking skin, and oftentimes you'll get blisters, and the burn will hurt to touch. Well, any of these burns will, to a certain extent, hurt to touch, but you should feel considerably more pain. Because the damage runs further down and through more layers of the skin, the treatment is notably more difficult. First of all, as with the first degree burns, running cool water over it, cool, mind you, not cold, is important. You want to do this for up to 20 minutes, but not for longer than that. The whole purpose of running cool water over it is not so much to actually cool the burn itself. What you're trying to do is get the blood vessels in the area to constrict somewhat. This prevents a lot of the blood that would go through it, releasing that water that's in the blood into the local tissue, contributing to the swelling and inflammation effect. By restricting that amount of water coming out of the blood, you can help with some of the other effects that will occur. For example, blisters, which will also develop over time. Now, these need to stay as they are. You do not want to pop them. And one of the reasons for this is that you'll be opening up the skin and thereby creating opportunities for pathogens to enter, but also the blisters are there to provide a degree of protection from all the damage that has happened. Now, if we're talking first aid treatment after that, you want to apply an antibiotic ointment, or something similar. The reason for that is that you want to prevent any infection that may occur. And to be clear, that is a very big risk, especially with burns, but burns that go this far down, you start to get into areas where you really need to be worried about it. Next, you want to dress the burn with a non-stick gauze, and you want to try and change it regularly, but you also want to be gentle, which is rather difficult. Being gentle with the burned area, it can be quite hard and rather distressing to whoever has been burnt. You also want to provide pain management. Now, ibuprofen or acetaminophen are going to be the best options here. You won't have access to anything stronger anyway, unless you're trading in illicit goods. but assuming that you're a regular person, that's about all you can manage. Once you've got the person comfortable, you've wrapped the burn, and everything else is done, seek medical care. You really do need to do so, particularly if second-degree burns are extensive. The healing time can vary, but typically we're talking weeks here, at least 2 to 3, if not more, and there is likely to be some scarring effect from the burn. The final type of burn that's commonly seen is third degree, and it's not third degree as in being questioned by your parent or the police. Rather, it's called a third degree in that it's the full thickness burn. That is, it goes all the way through the skin layers, and arguably it can get down to the fatty layer underneath, and even in some cases all the way to the muscle, although that is more rare. This is also why third degree burns typically don't appear red. Rather, they're going to be black, brown, white, or yellow. It's also not going to hurt. Now, that's not a good sign. The reason it doesn't hurt is that you've damaged the nerve endings, meaning you don't have sensation, meaning you don't know how badly you've now been burnt, which is really not a good thing. Typically speaking, however, the lack of sensation is only in the burnt area or immediately around it, which is one indicator of it being a third-degree burn. The skin itself may appear white, blackened, or even somewhat leathery in nature, and again that owes to the nature of how much it's been damaged, the way the heat's affected it, and the surrounding tissues, for example, the lipids underneath. Third-degree burns also won't produce blisters, and this is simply down to the fact that the damage is specifically located in a manner of speaking, and so you've burnt through the areas that would have otherwise blistered. There's also deeper tissues, and these are the concern here. In severe cases, things like muscles, tendons, and bones can all be damaged by third-degree burns, and obviously, they're kind of important. To be clear, skin is important, but skin, to an extent, can be grafted far more easily than muscle, tendons, or bones can. So, your treatment options when it comes to skin are far more promising than if you have muscles, tendons, or bones damaged. And this is also another problem because you may not realize it because you have no sensation of pain. A treatment is, well, this is pretty much in the realm of only professionals to deal with. Emergency medical care is the first and foremost thing. Call whatever your local emergency phone line is and try and get help. Or if not, try and get the person to help, preferably a hospital. But if a hospital's not available, work your way down through the various options until you get to your local shaman or witch doctor. The focus for you until you get that emergency care should be on ensuring the person is stabilized. Essentially, you want to try and avoid them going into shock and to prevent any infection if you can. The individual, once they are in hospital and once they have been stabilized, they have an IV line in them and everything else, will have debridement done. Debridement is the removal of dead or damaged tissues. Typically speaking, this is going to be done surgically. The reason they do it is to both reduce the risk of infection because all that damaged tissue can create a nice, lovely, hospitable environment for, say, bacteria to set up a colony. And also, it releases various chemokines, tactokines, and similar that can cause unwanted and certainly unneeded necrosis. Further, you have the clean healing of the wound if you've removed all that damaged tissue. Essentially, you're containing the damage as much as possible. We then get to the point we mentioned earlier where it may be necessary to engage a surgeon to do skin grafts. This will not only replace the damaged skin, but typically involves taking damaged skin from another part of the body and then putting it to the burn site. A lot of the time, even before you get to that stage, just to ensure the individual is stabilized, they'll begin providing intravenous fluids and medication. The fluids are there mostly to provide for hydration and stabilize blood pressure. Medication will be things like, say, anti-inflammatories or antipyretics, antibiotics, and analgesia to help with the pain involved, because gradually the pain, if not from the burn itself, other parts of the body that have been affected, will start coming through. Once the burn itself is recovered, which may be months of recovery, the next thing will be rehabilitation, remembering that the damage can be extensive, and be able to, say, reuse your hand from a third-degree burn is likely to be very difficult. Finally, particularly if we're talking about third-degree burns, you are definitely going to end up with scarring. It's unfortunate, but unavoidable. But the other one you're going to get is what's called contractures. Contractures are where the skin tightens, and it's particularly notable around scarring, where the scar tissue itself will heal, and that will be a relatively obvious white tissue. But the skin, each side of it, will begin to contract just slightly from that. And given the extensive area of third-degree burns, the amount of contraction will be significantly more. Strictly speaking though, there is let's say a fourth degree as such. It's not really a proper term, but it's still a thing, but used more as a shit that is bad summary, and people can understand how bad it is from just that, than it is actually explaining anything. It's the fourth degree. Now this is the arguably deepest and most severe burns, and it's also going to be burns that are life-threatening. These burns are like your third degree, where they go through all the layers of the skin, but it's where we actually start to see considerable damage to the bone and muscle and tendons. And this is where not just is it damaged and you might be able to recover, but you have significant damage, and in many cases, if you're at this point, probability of, if it's a limb, if being amputated is much higher, because at that point in time, the damage is probably so extensive and so deep that there is no way to fix you. You're better off, unfortunately, having the limb amputated and, well, not being dead. Or at least for most people, being alive, but an amputee is significantly better than being dead. Sometimes it's also worth pointing out that the amount of damage you experience will change, and this can happen particularly if we're talking about, say, if you've had a liquid spilled on you. The damage will vary based on where you've been exposed. So for example, bare skin, if you're wearing clothes, well, the bare skin will be more burnt because hot liquid, versus the clothes where the liquid took time to seep through and therefore it will have cooled down and there'll be less of it. And so, depending on where and how you've been injured and burnt, the injury may be deeper, more extensive, and more severe. If we're talking about somebody actually getting to a hospital, for a kid, it takes 10% of the body being burnt to be considered a major injury. However, for an adult, it's between 15 and 20%. There are, however, differences based on where you've been injured and how as well. And so, arguably, someone with a third-degree burn over, say, part of their arm may not be seen as much of a concern, say, as a second-degree burn over 30% of their body. There'll be a lot of triage and debate involved in that. The end result, however, is that you increasingly require more intensive care based on the nature and degree of the burn you've experienced. Sometimes it's just time away from social media, other times it's months and months in hospital undergoing surgeries and rehabilitation. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. And please do post any comments, questions, or suggestions that you have below.